She's got a stone.
Oh.
Could be that. She actually has a little stone there. We're going down here and you, my little dear, the same.
Oh, come on.
I'm not. She's got a stone as well.
Oh,
So you've got a stone too, my little dear.
Oh.
Hi everyone, I'm Lynn from Cavy Central Guinea Pig Rescue. Come here, gorgeous. You're going to have to remind me of names because I'm losing
This one is Smoky.
Smoky.
She is 3.5 years old.
I've met them before, haven't I?
Yeah, when she was a baby.
Oh, right. Wow. So she's 3.5 now.
You had her brother. We gave you her brother.
Okay. Right. Hello, gorgeous.
She had the diarrhea last week and we put her on hay and dry food for 3 days.
Do you know what caused the diarrhea?
No idea.
There's a bald spot just behind the ear.
She's got a stone.
Oh.
Could be that. She actually has a little stone there.
Like a bladder stone or what?
Yeah. Urethral stone. She does. Could be that moved and has caused a bit of an issue.
It was swollen and...
Was it swollen?
Yeah.
Yeah. She may have passed more of one and this could be residual then. Because it's small. This is tiny. So what's going on? I know you don't want me to touch it. She's definitely had something with it. A lot of bladder stones. We call them urethral stones because they've travelled from the bladder out to the ureter. And I can tell because it's, I know I can feel it. Yeah, it's quite high in. It's still there. It's actually high in. It's, yeah. What I might do, I'm going to put some numbing cream on her.
What, you just press it out or what do you do?
Oh, yeah. There's a bit of detail in that, so maybe probably the easiest way to... No, she's good. Easiest, she just doesn't want me to do anything there, which is understandable.
So I store mine in an old
So no, you definitely can't press them out because there's very, very delicate tissue there. Sorry, sweet pie. I know you don't want me to.
so that's $25 and that's 28 for each double sacks and 70 for each.
Sorry?
Right.
Now, we're just going to leave that. I'm going to leave you on the grass for a minute. Chocolates with a wet bottom.
She always has the dirty bottom, not wet, because we check wet.
Sometimes it's wet and sometimes it's not.
Always dirty. Look at her. She's a dirty pig.
Well, we're going down here and you, my little dear, the same.
Oh, come on.
I'm not. She's got a stone as well. So you've got a stone too, my little dear. Look at that. So that's what's causing all of this. Okay. So
is that calcium-rich food? Do we give them too much calcium-rich food, or what is that?
Look, it is. Stones are where the body is trying to excrete calcium, and so if you can push a little bit so we can get a glob on there, thank you. It is where the body has an excess amount of calcium and stones form. But you'll hear lots of people say that they can't have calcium in their food, you've got to eliminate it.
Yeah, that's what you read.
Yeah, but
they need it for the bones.
You need it for bones and teeth. So you cannot eliminate it, that's wrong. And we have found it just doesn't work.
Okay.
We have guinea pigs that have had stones, so I'll get you to push that again for me, thanks. That have stones, and so I know it's sore, darling, I'm sorry. I know, we're just going to hopefully numb that down a bit.
So there are still these ones.
There we go. Alright, so we'll put that one there. And then we'll put you down for a little bit. Okay.
I mean, like,
Yeah. She's
Yeah,
always been fat.
she is 8 years old now.
She ate.
She turned 8 last week.
She's gorgeous.
And we adopted her from you a while ago.
There you go. That's nice. My Snowy's over 10, so she's a long liver. She's gorgeous. Gorgeous, gorgeous girl. No
She's
stone.
got all these lumps.
No stone.
Well, but she's got all the other lumps.
Yeah, these are called fatty lymphomas.
Yeah. Last time
And they're
we
usually
showed her to
benign.
you,
Yeah.
she had one, and now she's got many more.
Right.
Up there.
Yeah.
I don't think they cause her.
No, they're fatty lymphomas. They just grow. That's fine. There's nothing there. Good. No, we really, with fatty lymphomas, She's got a big one under here, hasn't she?
Yeah, you can feel that whenever you pick her up.
Yeah, that's slightly different. The texture to it is different. I have a similar situation with Snowy at the moment, who's over 10,
Okay.
because he's developed a lump, which is solid. These, like this one here, no questions, fatty lymphoma, and here. But this one here, that's bigger, has got some nodular feeling to it, and and the nodular feeling, it's more solid, so it feels more solid, whereas the fatty lymphoma is very smooth and fatty-like. It's just very soft. So there's difference in the tissue there. And the question I have with Snowy is, who's over 10, is like, okay, if I do an invasive test to take skin cells to see if it's cancerous, it could come back that it's benign. In which case I've jeopardized his health, because he is very old. He's like a centenarian. He's not in pain, he's not struggling with anything, but at the same time he's got, different, you've got all those considerations around what to do. If he was to have surgery, that's even more risky. But then if it is cancerous, you'd want it to go. But in light of what, to live 6 months more, or like it, you've got all these questions when they get elderly as to what to do. Hello, hi, how are you? Hold on. And so you've got all these questions you need to weigh up. So while she could actually surgically remove this one here, you've still got the other one underneath, which is actually a fatty lymphoma. I wouldn't look to do anything with it anyway. In terms of her health, it's really good. So, has she lost a bit of weight lately?
No, if anything, she's gotten more fat.
Okay.
Big.
Well, what I would do is look at weighing her regularly, so that you can...
So if she gets lighter, then
yes.
probably go to the vet or something.
Yeah, I mean... It's really a tricky one. Like, the sooner you get on top of it, the sooner you can do something. But at the same time, given she's 8, you've got to weigh that up.
So we'll just watch her. And
I would watch her.
If
The
she
thing
feels
that I
happy
would
and
do,
eats and walks.
well, I would give her turmeric. So turmeric powder, I would put that in water, like her toothpaste, and I'd give her a little 0.1 or 0.2 of a ml a day. They don't like the taste of it, but I've actually found, we had a guinea pig called Crystal, who was seen by an exotic vet here in Sydney, who gave her 3 months to live, and she had more of fatty lymphomas on her than you could count. One of them ended up opening out, and that's the risk with these. They can get so large that the skin becomes thin, and then it opens, and then it's open to infection. Oops, I think my phone might be almost falling. It's okay. Yeah, so basically, we got her onto turmeric. She lived 4.5 years. So, and her family are in the UK, so we stayed in touch with them the whole time. So it was quite a happy outcome, but it was turmeric that actually helped with that. So, it's something to see. The first thing I'd monitor is the weight. I'd do that every week, monitor it and see, because if it's declining, chances are it is something more nasty like a cancer, because we do see weight loss with those cases. But if if she seems to be travelling okay, I think I'd be letting her turn 9.
Yep.
Yeah, and going with that. So, yeah, does that make sense?
Yeah. She's pretty good with kind of, if you give her anything orally, she'll just swallow it.
Yeah, she looks great. So she's awesome. She's super cute. Teeth are missing.
Yeah, I checked their teeth. Their teeth
Great teeth. Yeah, excellent. Really, really good. So yeah, she's beautiful. Yeah, some food for thought. Okay. Yeah, that's what you do, but nothing to me looks to be a worry. Only the one under the arm is a little bit more unusually structured. Yeah, it's also in a more accessible area than the other one under the abdomen. You wouldn't do the one under the abdomen. It's more accessible, but it is under the arm, joint, chest. When they do take something like that away, they take the skin tissue as well, which means they're often concerned whether they can close a wound like that. So, yeah, there's lots of considerations with it.
Yeah, I think a lot of surgical procedures with guinea pigs are not a good idea.
Yeah.
One time they tried to straighten the teeth of one of ours.
It's a bunny?
No, it's a hare. It's ours. There's
She
3 of them. The Archies.
she couldn't eat after that at all, and then she kind of slowly starved to death. It was pretty sad. bad.
Oh,
Grinding up
no.
her food for her and everything.
Oh, it would have been the back teeth as well. Yeah, because there's so many. Yeah, they're the Archies. The 3 Archies will come and visit us. So I'll give her back to you. We just need to wait a little while longer to try
For the others.
on the others and see if we can do something. Let's just see. Okay. Now, how about we do this? A special tummy wrap. Your paws. How's that? Is that better? We've put numbing cream on here. And you can almost see the stone. I know, little girl. Let me put another pair of gloves on. We're going to get that out for you. She's pretty numb down there. And you can now see the stone. So, yeah. See a little bit of discomfort. But bladder, when they remove a stone like this from the ureter, the surgical incision site can be really nasty and it's pretty horrendous. Whereas what we're doing, we've just made that numb. So it's numb on the surface, not in where the stone is. If that makes sense. Let's get you here. Do you want to hand her some grass? She can give her some grass. Over my shoulder. Had that moved again. It's moved again. Hold on. It's not a big one.
She's eating. She's fine.
Yeah. Oh, she is, but just while she's sitting here backwards. They'll sometimes sit and eat because they don't like sitting like this.
Yeah.
But the reality is she's okay. She's just need an opportunity to. It's almost there. It's like great. It's a really, really good outcome. So this is a bit they don't like, but this is literally just lubrication I'm putting in around the inside where the stone is. Good. There we go. And hopefully we can just get that out. Let's keep her busy there for me.
Yeah, I'm just feeding her.
That's it. Yes. I just need to very carefully. Good girl. Good girl. Just applying a bit more pressure there. Keep her busy there. I'm just going to move that.
It's okay.
That's the inside because they talk about it adhering to the edge. That's why we've got lubrication in there to help.
Is that the stone? Let me see that.
Oh yeah,
Oh my goodness.
that's it.
Oh, there it is.
There you go, stone out. No, I don't believe it's all out, but that's what we've
So
removed.
big.
Yeah, well that's tiny compared to some we take out. So I'm just going to sit here for a minute. I do believe there's a bit more there, but
Make a photo.
to show you, well this is what we do take out. So that's what I mean. This is a little stone compared to what
Still a big stone for a guinea pig.
I know that was a big stone in there. That video is next week. You'll be able to see that video.
Oh my god.
But it blocks their ability to urinate.
Oh.
So, but I'm just going to go back because I think there's in 2 parts. It felt like there was still a bit there.
Yeah. Good
So
girly
that's-
girl. Good girly girl. Oh, that looks different. I hope I'm not
Yeah.
in front of them.
Yeah, there's still more there. It still felt not right. Okay, sorry. You just need to eat more grass, little missy, just while I finish. Hold on. Oh dear, she says, I'm not doing that again. So what are you doing now? Like, I'm so sorry, but you'll be able to urinate properly, missy. Sorry, can you fit? Yeah, that's got it. Let's see if I can see that. Oh, little one. Little one, I'll put you there. And try this angle. Are we good? There's still a bit more there.
Let me see. Nasal.
It's okay, baby. Come on.
Keep her busy. Oh, she's. Hey, I'm sorry. We took it out. It's gone. It is gone.
She's fed up.
Wonder where?
Oh, you'll be a bit sore. Maybe. Good girl. Good Smoky. Oh, I think she needs to pee.
Yeah.
Maybe.
Don't you pee at me.
That's what she thinks of
I
you.
think she's thinking of doing something. She wants to. Okay, we'll come back to her. Can we put her on the ground? She may actually be able to pee out the little bit that's there. There's
Yeah.
a tiny bit still left.
Yep.
So
Take
we want
her
to pop her on the ground and then get number 2 that we're working with, and we'll get the little stone out with her. So we're going to put that one away.
Can I feel it? Is it
Yeah, you
hot?
can.
hard?
Absolutely. Like stone. Yep. They are. That's why there's the name stones.
It's like a little seed, isn't it?
But
Yeah.
you can see the video of the one
My goodness.
that's coming out. Just don't let her go, will you? That's the one that we took out
Oh my God.
a couple of weeks ago.
Oh
That
God.
video will just about go live, but shows you comparison-wise,
Yeah.
you know, how big and how different
Oh,
they
so
are.
she might have the same, you think?
She has a stone.
Yeah.
There's no mistaking it. She has a stone.
Oh, baby.
So, number
Oh, da
2.
kommt erst mal was anderes raus.
Oh.
Something else.
Yeah, they both have them. Get back to me. All right, let's have a look. You're going to be a good little patient too.
She's probably better. She's much more patient.
When she wants to be.
Yeah, this one is in a different
It's
position.
swollen as well, isn't it?
Yes, it is.
Yeah.
Yeah, she's got urine stalled around. You can see around this area,
Yeah.
and that's being caused by the pressure of this
Oh,
stone
baby. I'm so sorry.
coming down. It's not really near the front, but it is movable. Okay, so we can do the same thing. We'll just see if we can just carefully.
I'm not myself for a second.
It's getting some oil in around it to see if we can make it mobile at least.
It's okay, Missy.
Good girl. She's sitting there. What are you doing there?
She's like, why are you
What are
playing
you
down there?
doing there?
Now, while I've got her here, you'll notice this urine scald that's there.
Yeah.
You can put pseudo cream in and around this area as a barrier
Okay.
because the urine that she's excreting is burning that tissue.
Okay.
So if you do exactly the same as I did with the numbing cream,
Yep.
but I want you to put the, use a cotton
Yep.
tip, a bit of pseudo cream into that area, you'll feel she's so much better.
How
It'll
often?
I do it every 3 days or so.
Okay. Easy.
Yeah,
to get. Yeah.
yeah.
Easy. Yeah.
And that will stop this scalding from happening in it. You can see how inflamed it is
Yeah,
there.
poor
It's
baby.
very sore, but she knows she's got a stone. Like, she knows something's wrong, and I know it's a stone.
Of course she
I can
sits
feel it, but it's just not presenting enough at the moment. So, little girl, just gonna try.
Come here.
I'm not even feeling it with that.
Good girl.
Let's try and just see if we can. Best case scenario, if we've got it is mobile in there, which is good. She may be able to urinate that out herself.
But she has
'Cause
been
it's-
like that
it's quite high up.
for a long time.
Yeah, it's quite high up. So what I think we'll do is put some pseudo cream on there. I'll take another look in just a sec, but I think we'll probably go with some pseudo cream on there, and then check back in with me in a month if this is getting worse. It'll come down, it'll slowly get closer, and then we can remove it. The other problem is if they've got bladder stones that are, within the bladder area, they can be quite dangerous in the sense that they can stop them from urinating completely.
I know.
Oh, it's only a little girl. And it's nothing like the one we've dealt with either. So
It's bigger.
I know it looks swollen, but it's, you know, we're dealing still with a little-ish stone. I think it's
Okay.
bigger than the other girl,
Oh, but it's a small one.
but it's just in a place that's not close enough to the entry.
Okay. Yeah, we bring her back in a month and put the pseudo cream on.
Yeah, even, you know, it might even be 2 weeks or something, so just keep an eye on it.
Are you having open days every weekend now? Or?
Oh, we have something every week, but we do move the times around
Oh, okay.
depending on what is needed.
Oh, not nice. Keep in nice cars.
He doesn't want to eat it.
So the oil that we're using there is a low viscosity. Did they say low viscosity or high? Whichever one's really, really super, super thin. But basically
That'll be
it will
low.
be enough to get into and around the stone to help it move away from the tissue. So if she's urinating, she'll be able to flush it out, hopefully. That's what I think
Okay.
with her. So I think we go with that for now. That's a good plan.
Okay.
And keep an eye on that one. Let's just put some on. It's quite numb, but from before, but just doing this will
Yeah, just
make it comfortable for her. And I can show you how to do it. So we just literally, I wish we could get that. It's not showing at all. So yeah, just get a little bit of the pseudo cream and you're going to wipe it in under this area.
Okay, yep.
And up around the side where it's sort of ulcerated, just like that. But you don't, unlike the cream that we used before, the barrier cream is quite oily, and that just prevents any urine scald and poo to make that sorer than what it already is.
Super.
And that's it.
Yeah.
Awesome. So we're going to keep an eye on this girl, and we've got the other one removed.
And then next time we bring 2 other ones with us
Yeah, definitely. Yeah, that's absolutely fine. So,
to check. I
yeah,
get some of them.
There we go. I'm going to give her
Thank
to
you so much.
That is a pleasure.